Measles is the topic, also known as rubiola. Measles is a childhood illness that worldwide annually has 20 million cases. Of those, approximately 200,000 deaths occur, and mostly kids are involved in measles. But routine childhood vaccinations have helped to dramatically reduce the incidence of measles. For example, in the United States, because of routine childhood vaccinations, there have been only 63 cases per year in the past decade or so. However, this number has been rising in the United States and Canada because of immigrants coming from unvaccinated populations. So, as you can see, the importance of vaccination. You have 63 cases a year only in a population that receives regular childhood immunizations. And then worldwide, you have 20 million cases, obviously in geographic areas where children do not receive regular childhood vaccinations. A little bit about pathophysiology. The virus that's involved in measles is called Perixoirus, and it is highly contagious. Measles is spread mostly by secretions from the nose, throat, and mouth. When somebody coughs, these respiratory droplets are discharged into the air. In terms of symptoms of measles include fever and what they call the 3 C's: cough, conjunctivitis, and coryza, which means runny nose. So we have 3 C's in there. Fortunately, there are some things that are very specific to measles, since these are very non-specific symptoms. The first is something known as Koplik spots. Koplik spots are small spots that resemble grains of white sand. They are found in the mouth on the oral mucosa, opposite the first and second molars. So here's the first one. They are very small, but I hope you can see where those arrows are pointing to. You can see those small, tiny white spots. And here's another one that points to a picture of a complex spot on a person's oral mucosa. The next thing that is also fortunately specific to measles is the rash. Now, the rash by itself, the way it looks, is not that specific. It's just a maculopapular rash. But the way it spreads is a little bit of a diagnostic clue. It spreads in a way known as ephelocolip. It starts at the head ephylo and spreads down to the body. So it would begin on the face and behind the ears. And then this rash would spread downward toward the trunk and extremities. So the distribution in the way it spreads is important, and I'll show you a few pictures. So here's the rash, the way it looks. Here's another picture of a person with measles, and this is a picture that shows the distribution. As you can see, it initially starts on the face behind the ears and then later spreads downward, eventually going all the way down to the lower extremities. Complications. Unfortunately, measles can progress to rather serious complications, such as pneumonia, SSPE, which is an abbreviation for subacute sclerosing panencephalitis, and otitis media. Among all the complications, otitis media is by far the most common. Diagnosis of measles is really a clinical diagnosis based on physical exam and symptomatology. But you can do blood tests, and those blood tests involve measuring the measles IgM antibody. You can also detect the virus by doing a culture or PCR of either the throat swab or a culture of the nasopharyngeal swab. In terms of treatment, surprisingly, treatment is mostly supportive. Antivirals are actually not used, so you just treat the fever and provide hydration as necessary. However, giving the patient vitamin A has been shown to be beneficial. The reason is that a lot of patients with low levels of vitamin A will have a severe case of measles. And of course, because measles is highly contagious, limit the contacts that the patient has during those first 4 days after the rash begins, because that is the period when the patient is most contagious. And of course, because measles is highly contagious, limit the contacts that the patient has, in particular during those first 4 days after the rash begins, because that is the period when the patient is most contagious. And finally, I want to talk about prevention. Prevention is extremely important. You saw earlier in the video what vaccination can do. It can decrease the incidence of measles dramatically. The vaccine is MMR, measles, mumps, and rubella, and it's given in 2 doses. The first dose is given when the child is about 12 to 15 months of age, and the second dose is given when the child is between about 4 to 6 years of age. Lastly, I wanted to say that this vaccine can also be given to contacts of the patient within 3 days of exposure.